Welcome to Adapting Class. Are you struggling with fundamentals of nursing in nursing school or NCLEX preparation? In this video, I'm going to use common sense, critical thinking to break down NCLEX fundamental questions. No overthinking, just sharp clinical reasoning to help you use this strategy to answer fundamentals. Let's get to it. First question is a delegation and assignment case. Which task is appropriate for the nurse to delegate to an experienced, unlicensed assisted personnel? A nurse is caring for 4 clients on a medical surgical unit. Which one was she assigned to? Reinforce teaching for a client newly diagnosed with what? Diabetes. Monitor pain level in the client 30 minutes after IV morphine. Assist a client with Parkinson's disease to the bathroom. Assess the surgical site of a client who returned from the PACU 1 hour ago. I give you 10 seconds. Answer the question. And look at the way I'm going to approach this. Common sense. Stop the video. Answer it yourself. Think about it. What can a UAP do? I say UAP, all they do is ADLs. ADLs and safety pay, somebody who is stable. Anything that does not require thinking. That means it doesn't mean they don't think, but things that they can do just by that without not requiring thinking. By using common sense tells you that the word experience over there is a trap. If you see these questions again and you see experience, don't fall for it. The key and the concept and the memory trick for this question is, tell yourself the word experience does not change the scope of practice of a UAP. Just because it's an experience, it does not change their scope. Next time you see a question with experience, whether LPN or a UAP, that the word experience does not change the scope of practice of the UAP. If it doesn't, then they cannot reinforce, they cannot monitor, they cannot assess. All they can do is assist. That is ADL, test-taking strategy, critical thinking, and using common sense. They're going to assist. Number 3 is the right answer. That's the key word. Experience does not change that of a UAP scope of practice. Next question. Which client is currently addressing a self-actualization need? Maslow. You got to know it. And nurse is caring for 4 clients. Based on Maslow hierarchy of needs, which client is what? Currently addressing a self-actualization. Common sense, critical thinking. Break it down. It's common, right? A you. Actualization. What are you doing? What are you doing? Achieving something, personal growth, fulfillment that you have attained, or creativity, even in the presence of adversity. That's the definition. What do you think? A client recovering from stroke who is learning to feed themselves again. I want to do something for myself. A client with terminal cancer who is writing a book about their life story. A client crying after a recent divorce and requesting to speak with the chaplain, and a client feeling discouraged about their limited mobility after hip surgery. Think about it. Self-actualization, achieving something with the personal growth, fulfillment, creativity in a sense of what? Adversity. Whether you have adversity or you're achieving it. Let's look at the 4th one. A client feeling discouraged about their limited mobility after hip surgery. Well, that is self-esteem. They've lost it. They lost self-esteem. They are not assessing or achieving what? Self-actualization. A client crying after a recent divorce and requesting to speak to someone. The husband or the wife who died, there was a love and belonging. Now they've lost it. Emotional connection is no more there. They want to speak to somebody. That's love and belonging. A client with what? Terminal cancer who is writing a book about themselves, they have achieved that personal growth, fulfillment, even in the life of this, in the presence of all terminal cancer, they want to write a book. A client recovering from stroke who is learning to feed themselves is what? This is a physical need, regaining ability to perform tasks that they used to perform. Therefore, the right answer is number 2. Which action should the nurse prioritize? A nurse A novice nurse is preparing to perform a digital rectal examination of a client with what T3 spinal cord injury. Which action should you prioritize? Place the client in the left lateral position, apply NAMI lubricant over the glove finger, provide privacy for the client, insert the finger gently into the rectum. Look, this is why I said common sense is critical thinking. Think about it. There's a reason why I put T3 spinal cord injury. Buzzword, digital rectal exams. Buzzword, and then what? Prioritization. Buzzword. If you think about it, if I'm going to examine a patient, well, I'm going to put it in the left lateral position if I'm doing digital rectal exams. I'm going to use a lubricant. I'm going to provide some privacy. I'm going to insert my finger gently. But look at it. Why would I connect all this critical thinking, critical reasoning? But the common sense tells you, look, if I'm going to provide all these things, then I'm going to pick the one that is less obvious and the most important. Ask yourself, why is T3 there? Because spinal cord injury above T says, whenever you stimulate them, they're going to go into what? Shock. ICP will go up. They have signs and symptoms of ICP, and they develop what? Autonomic dysreflexia because of this. Therefore, if I'm putting my finger and examining them, I have to make sure I don't stimulate them. They can be in the left lateral position. I can provide privacy. I can insert my finger gently, but my finger is still going. The best thing to do is to put the lubricant in your hand. That is what? NAMI, like lidocaine, so that they don't feel it. Do you see the question? Test-taking strategy, common sense, and what? Critical thinking. That number 2 is the most serious and the most important one to prevent what? Autonomic dysreflexia, because that's the content I'm using. Next question. Which initial next action is required? And it's because for a client in long-term facility who become what? Acutely confused and agitated. A draining sacral wound is noted. What would you do? Apply a dressing to the wound, notify the air care provider, reorient the client, and obtain the client vitals and temperature. Once again, common sense. Patient get admitted in the nursing home. Okay. All of a sudden, I'm confused and agitated. What's your content tell you? That's delirium. But when you check, he has a wound. The patient has a wound. I don't know. You know, delirious, there's so many side effects that can cause it. Medication, infection, sepsis. But how do you know this sacral wound is the one causing the problem? Common sense. You got to assess before you figure out that you talk to the doctor. Dressing the wound, ignoring it. Notify the air care provider you don't have enough data. Reorienting the client, you treating the confusion. But when you obtain vitals and temperature, what are you doing? You're assessing, getting more information to figure out whether it is sepsis that is causing the confusion. Number 4 is your right answer. What would I do? And let's determine teaching is effective if the client makes which statement? Buzzword, effective. A clinic nurse provides discharge teaching to a client after hip replacement surgery regarding necessary assistive device for use at home. The nurse determine teaching is effective if the client makes what statement? Stay back, watch yourself, analyze the question before you look at the answer choice. Tell yourself, I have hip surgery, I need certain things, and I'm going home. 4, information. You write it on your own. What do you think I need to know? Content and your common sense tell you, well, you can't leave the hospital until you're walking. You can't leave the hospital until you're walking. Therefore, no wheelchair, right? You can have a cane, but you got to walk. 2, they're going to tell you what the nurse will tell you is no flushing more than 90 degrees. Otherwise, you're going to have dislocation. Use this content and say, boom, why do I need a shower chair? Well, I don't want you to burn. Why do I need a handheld shower? I don't want you to burn. If you don't want me to burn, then I should keep my toilet seat low. Negative. I'm not doing that. I will need a wheelchair. What? You have to walk before you leave the hospital. Therefore, no more wheelchair. I will need a handbrake for my car. When you're ready to drive, your leg is already fine. You can still use your leg to brake, not your hand. Therefore, which one? Effective teaching. Shower chair, handheld shower, right? Toilet seat low is wrong. which is wrong, and break is wrong. So 1 and 2 are your right answer. Common sense, critical thinking, NCLEX practice question, fundamentals of nursing. And we're using that information to answer this question. Fundamentals and foundation of nursing. You have to build this to be able to answer questions like that. Thus, it's just straightforward, but it requires some critical thinking and common sense. Think about it. I'm not hiding anything. I'm just showing you. So when you see questions, step back. The NCLEX, there's some questions that is all, you don't have to study everything. Sometimes you get to apply these little tricks, right? Which device, because this is what makes the foundation of medicine and nursing. Which device is required to withdraw the medication? The word said withdraw. I got to pull something and then prepare oxytocin, pitocin from a 1 ml amp labeled 10 units per ml to infuse in 1 liter of IV fluid. What would you do? Supposed to prepare 1 ml amp that is labeled 10 units in 1 ml, and he put it in what? 1 liter of IV fluid. What device would she need? I know you know this. I know you watch adapting class, that you know when you drawing an amp, there's certain instruments that you need or devices. Even if you don't know, look at the answer choice, common sense, 1 ml. If I have to draw a 1 ml of a solution, what am I going to use? 5 ml syringe, 3 ml syringe, non-sterile gloves, and 5 gauge needle. Even I can't draw anything with a needle because I need what? A syringe with it. So that itself doesn't answer the question. Well, sterile gloves, well, if you're drawing something from an amp, you need a sterile gloves. Now you're left with 3 to 5 ml. A 1 ml solution, the best syringe to draw it is what? 3 ml. 5 is too big because of the calibration. If you want to inject, you said, yeah, you need an injectable needle and a filter needle. The injectable needle is what will be the 25, but it's too small. At the same time, if you have to inject, you need something bigger, 18. So for this question is asking you about what? How do you draw something from an amp? 1 ml requires 3 ml syringe. A med-surg nurse prepares to administer 1 unit of PRBC to a client due to anemia. What would you do? Ensure patency of the primary IV. Identify the client using 2 client identifiers. Review the medical record for informed consent. Verify the product with another licensed professional. Blood draw. What are the things you do? You know it. I want you to take one, the most prioritized information. What do you think? You check the IV, you check for consent, 2 identifiers, or somebody to verify the blood. All of them are important. But common sense, NCLEX practice question, fundamental of nursing, foundation of nursing tells you can't do anything, procedure, without a consent. You cannot do a procedure without a consent. I need IV to be perfect. I need to verify it with 2 identifiers. I need somebody to license provider to also look at it. But if you have no consent, you're committing battery, touching the patient, giving them something they've not consent for, you are in trouble. Number 3, right answer. Which policy is the team most likely evaluating? Select or apply. A nurse supervisor is leading a quality assurance team to review medical hospital policies related to Sterile Technique. Which policy is the team most likely evaluating? Insertion of peripheral IV, performing hand hygiene before client care, insertion of a urinary catheter, applying oxygen via nasal cannula, food preparation by the custodian team. This question, I said it, I thought about it, I said, look, guys, common sense. Fundamentals of nursing is what you do every day. You know it. There's a buzzword in the question. There's a lot of information. Sit back and tell yourself, what do I focus on? The nurse supervisor, quality insurance team, or what? Sterile Technique. He said what? To review the hospital policy related to what? Sterile Technique. So the question is asking me, Sterile Technique. Which of this is Sterile Technique? That's all. IV insertion, we insert it all the time. It's not sterile. It's clean procedure. Performing hand hygiene before client care is experience and what? Usually care standard that we do. Normal standard, expected finding that we do all the time. Insertion of urinary catheter is a sterile technique. Applying oxygen is not sterile, an expected clean procedure. Food preparation, they never use sterile technique. They are usually clean. Therefore, which one is the answer? One answer, and that is what? Insertion of urinary catheter. This question is testing your ability to focus on a keyword using common sense, and that is fundamental of nursing. And let's care for a toddler with a blistered burns on the posterior buttock and lower leg after pulling boiling water off the stove. Which action should the nurse prioritize? Separate the toddler from the parent, report the event to the Child Protective Service, obtain the toddler blood pressure and heart rate, cover the burn with the clean, dry dressing to prevent dehydration. If you see a question under NCLEX, nursing school, and it's about injury, fundamental of nursing tells you, take care of the patient. The rest can take care of it. Make sure the patient is okay. Which answer choice saying patient is okay. I want you to stop the video, put the answer down, and let me know what you think. What was your answer for this question? Think about it. Separating the toddler from the parent, you are assuming the kid was abused. Fine, if he's abused, take care of the patient first. You don't know. Burn wound to the buttock, that's a lot of burn to the lower leg. I'm going to report it to the Child Protective Service, but take care of the patient. Obtain the toddler blood pressure and heart rate. I'm taking care of the patient. Cover the burns with the clean, dry dressing to prevent dehydration. It's a trap, right? You're focusing on the burn, not the patient. Because when you burn yourself, resuscitation is the key. Check the circulatory system and make sure you're doing okay. Therefore, 3 is much better than number 4. Addressing these needs reflect which level of Maslow hierarchy of what need. And that cares for a client admitted with what? CHF. The nurse observes use of accessory muscle in determining the client required oxygen, which is Maslow level. Do you think I'm being addressed by doing that? Think about it. The patient needs oxygen, which is life. And if you need life, is it a safety issue? Is it a physiological issue? Is it love and belonging or self-actualization? Stop it. Let me see what you think. Self-actualization is achieving something, personal growth in the presence of uncertainty or unusual situation. Love and belonging, coming together, right? Where you have emotional contact. And out of that, you develop your self-esteem. Safety and security is where you worry about life, insurance, policy, financial. There's nothing financial situation in here. All I care about, give me oxygen, which is the physical need. Give me physical need. Give me food. That's a physical need. Give me elimination, physical need. Oxygen, physical need. The nurse is providing physical need. Number 2. Same thing. I put experience to trap you. A registered nurse is caring for a group of clients on medical surgical unit. Which task is appropriate for the RN to delegate to the experienced licensed practical nurse? Develop a plan of care for a client newly admitted with pneumonia. Administer 1 IV morphine to a client with post-op pain. Evaluate the nutritional needs of a client with a new PEG. Monitor a client receiving enteral feeding via NG tube. Think about it. Once again, experience does not change the scope of practice. Once again, experience does not change the scope of practice of the LPN. LPN still cannot evaluate the patient. They cannot assess them. They cannot provide teaching, but they can monitor, they can reinforce. They can do tube feed. Therefore, which question is good? Developing a plan is not good. Administering IV morphine to a post-op patient is not good. Evaluating for nutritional need is not good, but they can monitor patient receiving enteral feeding via what? NG tube. This is the concept I want you to take with you. That your experience does not trump your scope of practice. Number 4, right answer. And the last one, a client recently diagnosed with cancer expresses concern about returning to work and providing for their family. According to Maslow, hierarchy of need, which need is most critical at this point? What is the one critical? Patient has cancer, is afraid of going to work and providing for the family. Providing for the family, financial need, financial security, financial ability to take care of the family. I know it's a bad situation to have cancer, but I'm not showing what? Personal growth. It can be self-actualization. I'm not talking about going and living with my family and enjoying ourselves. That's not love and belonging. We are not doing that here. Talking about safety. It's a worry about losing his job and his family. Of course, you got to have love and belonging before you can have self-esteem. Therefore, the two cannot be. The right answer, safe and security. 12 questions. I yield NCLEX. Practice question. Questions and answers. Fundamentals of nursing. Using common sense. Critical thinking. How many do you get? I know you ace it because you watch Adapt NCLEX. Thank you for watching. Thank you for your comments. Thank you for supporting this channel. If you like this video, subscribe to Adapt NCLEX and get more content like that. See you at the other side. Good luck in your exams.